It should now ask all of you, do you want to be recorded? And you can say yes. All right, are we ready to do this? All right, and I'm going to start with sketch comedy, Michael. Dr. Fine, I hope you're okay with that.
I'm ready.
All right, here we go. So hold on, let me spotlight this. I have to pivot, so hold on. Oh, hi there. My name is Michael Fell. I'm the senior rabbi of Temple Emanu-El, and when I'm not studying the week's parsha, I like to read fictional books like The Bull and Other Stories by Michael Fine, available on Amazon. Wayne Miller of the Providence Journal writes, Michael Fine is a master. From the first sentence to the last, this collection is a rare delight. So available on Amazon or at your local bookstore. How was that? Was that good?
It was all fiction.
I feel like a little levity as we enter this conversation of COVID is important. So Dr. Fine, I will turn it over to you and I will grab this and do this. And we can start with the most recent numbers. Take it away, Dr. Fine.
Thank you, Rabbi Fell. It's wonderful to be with everybody tonight. Let me start with some good news. The good news is that Rhode Island is the second most vaccinated state in the nation. We're about 72% vaccinated. And further good news is, though we've had over 900 deaths in 2021, and will likely finish the year close to 1,000, though we've had over 900 deaths, I'm sorry, in 2021, and will likely finish the year close to 1,000. That's half the number that we had in 2020, when we had 2,000 deaths. So we made progress, and that's a good thing. The vaccinations are a very good thing. We had some challenges now, and we learned some difficult things this week. The challenges are the numbers that you see. We are very close to 300 new cases per 100,000 per week. I am pretty sure we will be there by the time the numbers come out tomorrow. And that's tripling inside of about three and a half weeks. So that's a pretty intense jump upward. Our hospitalizations have climbed. I don't think the data tracker particularly shows this well. We're up 37% in hospitalizations in about 3 weeks. The week over week variation is confusing, but the trend is very clear. And we're now very unfortunately seeing 2 to 3 deaths a day, and we'll likely have over 60 deaths in November and probably more than that in December. I'm guessing between 75 and 100. So we'll very likely finish the year with over 3,000 deaths in the state of Rhode Island. The hard news that we learned this week is news from Vermont, which is the most vaccinated state in the country. They're even better than us, and they became a hotspot this week. And what we learned in that process is that immunization is excellent at preventing the hospitalization and deaths of individuals, but that immunization does not prevent the spread of COVID-19. What we learned is that in order to prevent the spread of COVID-19, you really need classic public health measures. That's masking inside, that's regular testing, that's isolation, and quarantine when someone is either sick or becomes a contact, whether people are immunized or not. And that's new information, something CDC has not yet announced itself. And even though we are more vaccinated than most other states, I also think it's worthwhile comparing us to other places that have done better. My son, who some of you know, Gabriel, lives in Toronto, and he sends me the numbers. And this is the evidence that other places can do, or places can do better if they approach the world with a fair amount of self-discipline and focus on public health measures. In Toronto, there are, well, thank you. Is this Toronto?
Yes.
Okay, you were way ahead of me. In Toronto, they have 15 new cases per 100,000 per week compared to our 300, so about 20 times less than we do. 1.1 new hospitalizations per week. And though the deaths here, I don't think are clearly indicated, my understanding is they have had almost no deaths in the past month. So while we are doing better than other states, we are not doing as well as we could do, particularly if we used classic public health measures, which we have not yet done, unfortunately. So that's what's kind of complicated. It's complicated that, we have a vaccine that's great at reducing hospitalizations and deaths, but it turns out that the ability to reduce spread still is about the classic health ability, the classic public health ability to control community transmission, and that the level of community transmission where we are is way too high to prevent transmission without the public health measures that I described, but which are not being widely employed. And I'm going to disagree in 3 places with CDC. I do that with great caution, but I think there are 3 ways in which I suspect CDC may change. I don't know that, but I hope. One is their description in the spring that vaccinated adults could be together without masks inside if they're not from the same household. I think that needs to change. And I do not now believe that vaccinated adults can be together. Vaccinated adults from different households can or should be together unmasked unless they have been tested the same day. Second, I think CDC has said that vaccinated people don't need to quarantine if they are the close contact of a case. I think that is proven to be incorrect. And I think vaccinated people, if they're a close contact, need to quarantine for at least 7 days and not leave quarantine until they've had a negative PCR test. And finally, CDC, and actually this is more HHS than CDC, the regulations that are coming down from the federal government are making the argument or laying forth the rule that if people are unvaccinated, they need to be tested once a week. I think that's a little distracting, and the right rule ought to be that any person, vaccinated or unvaccinated, who is involved in any kind of congregate setting, by which I mean shopping, going to the post office, being and mixing with other people, I think all of us, vaccinated or unvaccinated, should be tested twice a week, at least until the level of community transmission drops. And Rabbi Fell almost had me persuaded that we could live with 50 new cases per 100,000 per week. I think, as I've seen the evidence of the last week, I think that number really needs to be 15 new cases per 100,000 per week. That's the level at which we can do the classic public health work we need to do when there are new cases or outbreaks. And with that, let me turn it back to Rabbi Fell for his presentation of the directions that the very intense analysis that the reopening committee has performed People have really worked very hard at this and done a lot of thinking. Let's hear from Rabbi Phil about
So
that.
before we get to me, I want to ask you a few questions, if I may, Dr. Fine. Number one, what should people be doing, just to make it explicit so people can hear again, for Thanksgiving? I know there's lots of people traveling. What are you doing to make sure you have as safe a Thanksgiving Day Seder as possible?
Okay. Why is Thanksgiving different from all other days? We went and bought rapid tests, which you can buy $14 for 2 tests for everyone who's coming to Thanksgiving. We kept the number small. There will be 7. And everyone who's coming to Thanksgiving is going to do 2 rapid tests just before we all get together. So we know that everybody is negative-ish. By that, I mean, I don't think the rapid test is perfect. And I have said publicly that I'm not a big fan of it in general as population surveillance. But when you do 2 tests, you reduce the false negative rate, and the rapid test tells you whether you're shedding virus or not. And it's people who are shedding virus, whether they have infection or not, it's people who are shedding virus that are most likely to spread disease.
And number 2, can you talk to me about boosters? How important are they, and how critical are they for staying healthy moving forward?
We actually are depending on the Israeli data, which is the best data by far about boosters. And that data has shown that boosters significantly reduce disease, not disease transmission, but significantly reduce the risk of hospitalization and death for people who are vaccinated. And now in Rhode Island, boosters have been made available to all adults. I got boosted last week and strongly suggest that all adults get boosted as soon as they can. Not, there's no emergency, but in all due order. I saw a quick question in the chat about does brand matter? I got mine at Walmart, and I don't think brand matters very much. I looked at the data, and I think the rapid test kits that you can buy are all pretty much the same.
If I could add, I also got boosted at CVS. It was very easy to do, easy to set up an appointment. You can all do it after this meeting and schedule a booster. I also want to say that if you go to I get tested almost every week, a PCR test, and I can't tell you how easy it is to do this and how quickly it happens. Perhaps you remember the last time you got tested, you had to schedule an appointment, and it could take 72+ hours to get the results, and there were lines, and it was complicated. I go almost every Monday to the Dunkin' Donut Center. I park my car right on the street. I literally walk out of my car, walk 3 feet to go to the little cubicle they've set up on the sidewalk. I swab my nose, and it takes, if it's 5 minutes, it's because I'm schmoozing with the person behind the counter. It's very easy to do. And I suspect if you don't even need to make an appointment, you can just walk up and do it. It's easy. It really is easy, and it takes no effort. And in the same way how we've said, as you prepare for Rosh Hashanah or Yom Kippur or Pesach, like make getting a PCR COVID test part of your getting ready, you can also do it just tomorrow. Go to the Dunk Center and get tested. So this is my extensive medical training. This is can tell me it's easy to do, and you all can do it as well. Did I get that correct?
You got it right.
Excellent. I've drunk the Kool-Aid from you, Dr. Fine. So let me show you the results of where we are and how we arrived at our current COVID protocol. Let me just switch this setting here. 1 second. There we go. So in figuring out what the next step forward for our synagogue is, I like to think of our policies can be placed on a spectrum. On the one end of the spectrum is we pretend that we're done with the pandemic. We hang a banner up that says we're done with the pandemic and COVID is over, and we go to life as it was before. On the flip side, we say to ourselves that we are still in stage 1 of the pandemic where we don't know everything, and we should close the shul down and only have virtual programming. So if those are the two poles of where we can meet or how we can create a policy, then the goal is certainly to find something in the middle, something that certainly acknowledges that the pandemic is still going, that there's a surge going on right now. But number two, also recognizes that we have vaccines. We know a lot more about what measures can be taken to protect ourselves and protect our loved ones. So we're trying to really thread that needle. And so here's what is the proposal. And we set it up with a bunch of these givens. Given that schools, that kids have been in school since the fall, given that schools have been open for months without becoming centers of disease, and given that it might take months to get to a case of less than 50 cases per 100,000, and given that it's getting colder each and every week, and given that levels of community spread are high and climbing and a return to pre-pandemic practices are not safe, and given that 90% of adult Rhode Islanders have at least one vaccine, and given that attending shul is important and nourishing for our entire community, and given that there are plenty of typically adult-only programs and services, we make the following proposal. And before I give you the details, I just want to share a couple things. Number one, our current policy has been that only fully vaccinated people can come into the building. Once we opened up, really starting around Pesach of last year, we had made a decision to prioritize those who are fully vaccinated, to bring them into our sanctuary, into our prayer spaces, and create a space for them, while asking those who weren't vaccinated and children to be outside. And so for about 6 months, that's how we've operated. And I'm proud of our synagogue in that we've had in-person services on Shabbat and on Sundays for several months now. We were able to host in-person High Holy Day services in the sanctuary, in the meeting house, and also in the JCDSRI Moedon. And we've had kids programming for about 6 months now, outdoors, underneath tents in the parking lot or the JCDSRI Moedon. We have asked, as we brought Kiddush back, that only vaccinated people eat in the meeting house foyer or in the meeting house. And we've asked families to eat outdoors in the tent. And when it was 65, 70 degrees, 50 degrees, we were able to pull it off. But as it gets colder and colder, we want to make sure kids can still come back to shul. It's important not only for the kids themselves, but it's also important for the families themselves, the adults in that family as well. I'll also say that any change in policy that we create, I don't think is going to result in an immediate change in the makeup of who comes to shul. In other words, by changing our policy, I don't anticipate there's going to be 200 3-year-olds marching into the sanctuary and saying, finally, thank God I can come to shul. Or that all of a sudden a bunch of 4-year-olds or 5-year-olds are going to populate our daily minyan. What I think this policy does is it allows families to come to shul, also recognizing that kids 5 to 11 are also getting vaccinated. It means that you might have a family, and I'll speak candidly for myself, you might have a family of 4 or 5 where 80% of the family is vaccinated, and to limit one member of the family from coming to shul for the next 6 months, we miss shul and we want to be able to come back to shul. So here's the proposal. Starting Friday, December 3rd, and the reason why we're doing this in 2 weeks is because we want to inform everyone so they can make the right decisions for themselves and for their family. For non-food programs, which is primarily services, minyan, classes, etc., we'd like to change the policy that everyone is allowed to attend regardless of their vaccination status. Everyone will be required to wear masks in the building, and the synagogue will improve our signage about wearing masks and also provide more places where you can find those masks. And unless the person is leading services or for teaching, they can take their mask off if they're leading or teaching, provided they are physically separated from the rest of the community. In every experience or program that we run, we'd like to designate a space in the room for people who are fully vaccinated. Now, I understand that the air is the same, but we're trying to also make people feel comfortable and trying to create space for everyone as we try to thread that needle. So for example, we might decide that for Kiddush, for example, on a Shabbat morning, everyone can eat in the meeting house, but we can create a fully vaccinated section in the Sisterhood Lounge or in the vestry. So the idea is we can spread people out in the throughout the majority of the building. But if you're someone who says, listen, I want to minimize my risk and only eat with people who are fully vaccinated, we're creating that space for you, whether it's while we're eating, or if we're in the sanctuary, creating a quarter or a section of the shul where there can only be fully vaccinated people. We've already changed how we do programs in the shul to promote physical distancing. So for example, at our Tuesday night adult learning night and teen learning night, rather than pack all the tables close to each other, we spread them all across the meeting house. We open the door to the meeting house so there's more ventilation. And we put 4 to 6 chairs at each table instead of packing in 8 to 10. The idea is to create more space in between people. Already the rooms throughout the building have the advanced HIPAA filters, which are meant to prevent the spread of coronavirus. And we're also opening doors and windows when we can. Again, trying to provide as many options as possible. For programs with food, everything is pretty much exactly the same, except when you're eating, you can take off your mask. We'll still have the separate space, for example, for Kiddush, where you can have special sections for people who are fully vaccinated. As I'm sure as many of you might have experienced, we purposely purchased, instead of one large 40 by 40 tent, we purchased 2 20 by 40 tents. And so about a month ago, we took down the sukkah, if you can picture where this is in the shul, and we want to continue offering outdoor programming and outdoor seating options for as long as we can. We can keep the tent up until it starts snowing, and then once it snows, it has to come down. So these spaces are heated, and I'll put it in quotes, they're heated. There are heaters in the space, but as you can imagine, it's hard to heat a fully open tent. But it's also, we've changed how we do our programs so they're not so food centric. And so, for example, we're having our Hanukkah party on December 4th. And originally we were supposed to have this sit down dinner where you could, sit and eat and enjoy yourself. And we're changing it so it's more of an appetizers, pizza, hot apple cider, hot chocolate cafe, all taking place outside. And we're getting extra heaters for those nights. But the idea is to not make all of our programs food centric. And when we are going to serve food, try to make it so people will perhaps choose to eat outside. Obviously, Kiddush is an exception to that rule, where Kiddush is Kiddush. So that's the new plan. Hopefully, we're going to implement this starting on December 4th. On December 4th, it's our first Shabbat B'Yachad, where our religious school students come to the synagogue. What we're hoping to do is we still won't bring in all of those students into the sanctuary, but still have a separate service for them. Tat Shabbat will meet in the Sisterhood Lounge, I believe, because you can open the doors and have some heat and some outdoor air. And our junior congregation will meet, I think, in the meeting house foyer, because you can open those doors as well. For those who don't know, we had about 25 kids at our youth programming last Shabbat, which if you don't see it or you don't participate in it, you don't know that there's this whole ecosystem, this whole world of our synagogue that we just haven't seen for 6 months because they're always outside. But they're here, they want to be part of our community, and they are part of our community. And I think it's important to find a way to integrate them as the days get colder. I hope we can all agree that telling our youngest congregants that they need to spend the next year or so not in shul again is not a full expression of all of our values. I hope you'll agree with that. And also taking care of our older congregants, right, is also an expression of our values. So this is the line that we're threading. That's what we got. That's the presentation. I'm happy to field any questions, if you want to put any questions in the chat room, or any questions in the chat room about our synagogue protocols, or any questions for Dr. Fine, feel free to put those in the chat room.
And I think there are a couple of questions in the chat.
All right, let's see what we got here. Hold on a second.
Do you want to pose them and I'll try to answer them?
Sure. Let's see. Toby Leibowitz writes, I love your program. I love your fictional writing. She asks, will we need boosters every 6 months?
And the answer is, I don't know. I just don't know. We're learning as we're going. And I thought until last week that once we got all the kids vaccinated, we would basically be done. And now I'm not so sure. So we're learning as we're going. My best guess is that we will need boosters, every 6 months to a year for 2 or 3 years. And then as more people both get vaccinated and contract the disease, which they will, most of us will eventually end up getting it, that we will develop more robust immunity, more of what's called community or herd immunity. And this will, over 3 to 5 years, retreat into being just a cold that passes around from time to time, and doesn't cause hospitalizations and deaths. But those are hopes based on some experience, but not based on any science.
Let's talk about masking, cloth masks versus N95. Are there big differences? Is it worth going out and purchasing the N95 masks, the KN95 masks, the I95 mask? What do you recommend?
Well, better is better. There's a recent study in the British Medical Journal that shows masking is the most effective way to prevent disease transmission. It's supposed to be 56% effective, and N95s are better than some of the stuff you buy, sort of in the sort of local convenience store. The real strength of masking is that it reduces transmission from an infected person. That's the evidence that we have. We think that it probably reduces either the likelihood of getting the disease, or it almost certainly reduces what's called the viral load for people who are not infected but might get it. But this is one of those things where we're shaving points and more is better. There's no harm in using an N95, and there's no harm in double masking. Many of my colleagues who use N95s also double mask. They are, physicians and nurse practitioners and PAs who are actively seeing patients, so they have a little greater risk. But, like I said, this is one case where more really is better.
I remember, Dr. Fine, I think at our last last update, I remember people were presenting different situations, right? I'm going to a wedding that's outdoors, but it's a really touchy-feely family, so we're going to be hugging a lot. Or I'm going to an indoor wedding, but everyone's getting a PCR test 4 days beforehand, but they're all traveling to this remote village. And so a lot of this is using, I think it's called, they call it the Swiss cheese approach, where there's masking and physical distancing and regular testing and vaccinations. And so it's a matter of using all these different tools while at the same time minimizing our total overall risk and sort of choosing where do I want to expose myself, or how do I want to be at risk?
Yeah, and when you think about it, for example, regular testing helps protect the community from community spread by identifying asymptomatic disease. But a family that's getting together, even if it's doing regular testing, understanding that the regular testing runs 1 to 2 days behind in terms of reporting. So a family getting together does a little better by adding rapid testing, right before the event.
All right. What are they doing? What are they doing in Toronto that makes them so much better than what we have?
Outside of being incredibly nice.
Yes, and the Tim Hortons.
Yeah. They are masking inside and have been masking inside rigorously. They do much more rigorous testing and then isolation and contact tracing. If you come across the border, in order to cross the border, you both have to be vaccinated and tested within 72 hours. And then they call you to check up on you once you have arrived in Canada. They are really on top of it in a way that I don't think we have been in the United States, at least not since the beginning.
What is your philosophy about mixing boosters, getting the Moderna if you initially had Pfizer and whatnot?
The evidence shows that mixing boosters is generally a good thing There is an advantage mixing a booster if you got Johnson & Johnson or Pfizer. There is actually no advantage to mixing a booster if you got Moderna. So getting the Moderna booster, there's nothing that improves on getting, if you had Moderna, getting the Moderna booster. You can get the other booster. Most people are only boosting with Pfizer or Moderna, but you certainly can get the Pfizer booster if you got Moderna, and it won't cost you anything. But if you got Pfizer, Johnson & Johnson, getting a different vaccine for the booster seems to have some protective effect.
I don't mean to put you in the hot seat, but if we know that indoor masking is one of the most effective ways to reduce levels of community spread, then why isn't it mandatory in Rhode Island?
I am going to pass on that question.
Okay, I just wanted to.
Governmental decision, and if you are not comfortable with it, I strongly suggest you call the governor's office and call your local state rep and say something. This is a democracy, and this is how we make the democracy work.
Is it safe to fly?
Is it safe to fly? Well, I haven't seen evidence that it isn't. But both flying and taking a train, and I think somebody asked a question about the train. They are generally very precise about making sure people stay masked, which is a good thing. The airlines have said over and over again that they have very good filtering. I'm trying not to travel now. I traveled a little bit a month ago, but I've stopped traveling because, it's not just being in a plane or train, it's being in the airport and the train station. This is a time when less is more. People at greatest technical risk are people who are over 65, and I know you won't believe this, but I'm in that group. And as you get older, your technical risk increases. So that, I think a 35-year-old can likely fly without significant risk, but I'm not sure that's true of an 85-year-old. I think if I were 85, I'm personally trying not to fly and won't probably fly until the numbers come down. And if I were 85, I don't think I would be flying or shopping right now at all.
I think by now most people know the merits of vaccinations and boosters. What would you say to a relative or a friend who is vaccine hesitant?
I don't think there's much that can be said at this point in history. I think the arguments have all been made. I think the evidence is clear if you believe evidence. I think it's worth approaching that person with kindness and compassion, not with sort of criticism and rancor, because I'm not sure, I don't think there's any evidence that gets us anyplace. It's listening to what they think, listening to how they believe, and telling them what you honestly think yourself. And that's, I think, the best that any of us can do right now. Remember, and this is the critical idea, and has become much more clear in the last 2 weeks. The person who doesn't get vaccinated puts themselves at risk. It's not clear that they're putting the rest of the community at huge additional risk. It's some additional risk, because people who are not vaccinated get a higher viral load, and the viral load stays around longer. So they're more likely to transmit. But guess what? The rest of us can transmit as well. So all that, stuff that we had 3 months ago about, those nasty people who aren't getting vaccinated, I'm not convinced that was justified then, because we can all get infected just as well. The thing to think about when you think about that person who's not vaccinated is strongly encouraging them to mask when they are in a public place, and encouraging them to get tested twice a week, just like the rest of us should. That's the way to protect the community. And the most important thing, I think, and this goes back to the question about Toronto in a certain way, the most important thing to do is for us to find a way to do this as one people. Because if there's a difference between what happened in the United States and happened in the rest of the world where they've done, in the parts of the world where they've done this well, is that our division and our rancor, I think, is what is caused us, frankly, to fail at containing this virus. So it's most important that we listen to each other and do what we can to be one people, so that we can approach this threat together and do it more effectively than we have in the past.
Let's say, we go, I mean this in a purely social media context, we go viral and people hear your message and say, you know what, I'm going to do a better job about masking. I'm going to start wearing a mask when I go out into the post office or when I go to the supermarket. Walk me through the next 2 to 6 months. What could numbers look like, and what could things look like this spring? And I think we'll wrap up with that hopefully optimistic outlook.
Yeah, I don't think we know, but I think Toronto is what we could look like. I think if we really all did this with discipline, and for me, that means everybody who's involved outside their homes testing twice a week. It means masking anytime you're in a public place. It means making sure that schools are vaccinated. We vaccinate kids against 10 different vaccines. They're required for school entry. So I think we ought to be requiring this vaccine for school entry as well. It means that we take particularly good care of people who are over 65 and or have chronic disease, so they don't feel like they have to leave their homes. And that we do a really good job at isolation and quarantine when anybody's positive, and quarantine anybody who is who's a contact. I think then we could have numbers like Toronto. It'll take 2 to 3 months, even so. But I think we could do it if we did it together.
Last 2 questions, and we'll wrap up. What do you know about another variant? Is there another variant on the horizon?
I was actually thinking about that today. I haven't seen evidence of anything emerging now, but here's the danger. The danger is that only about 5% of the poorest communities, the poorest nations in the world, are vaccinated, which means I think we will see way too much virus spread, way too much death in those places. And those are the places where new variants will emerge. So it wouldn't surprise me if we have a new variant. Hard for me to imagine a variant that's much more transmissible than the Delta variant, which is amazingly transmissible and has been fairly difficult. But I would not be surprised if we have a new variant, and that we won't have this thing damped down for 3 to 5 years altogether. Though I hope and pray it happens sooner, and it certainly will happen sooner in the United States if we can start acting like one people.
Last question. Who's still getting COVID? Is it people who are unvaccinated? Is it people whose immunity has waned because they got their vaccine 6 months ago? Is it children? Who is getting COVID now?
Everybody. 40% of hospitalizations or about 40% are people who've been vaccinated. And I don't know the extent to which people who have been boosted are getting COVID as well. But remember, the point of the effectiveness of the effectiveness of the vaccine is to reduce hospitalization and death. It does not prevent you from getting the virus, nor was it intended to. Well, we would have liked it if it did, but it just doesn't work that way. And I think that's the real learning of the last 2 weeks, And that's something we all have to sort of integrate into our ways of thinking about ourselves and our community and about this virus as we go forward. That it is the vaccine prevents hospitalization and death, and that's great. Rhode Island, we dropped our deaths in half inside of a year, but it doesn't prevent the spread of the virus. We need to do all those other things to prevent the spread of the virus, which are, again, masking outside, making sure the elderly stay home. I forgot one thing. One of the things we've learned is that it looks like people who are, elderly and infirm, or have significant chronic disease, if those folks get the virus, their risk of hospitalization and death approaches those people who are unvaccinated, which is why we have to work so hard to take care of them. But if we do masking and making sure that every single person gets vaccinated and boosted, and we get all the kids in schools vaccinated, and if we do testing and isolation and quarantine, that's how that's what we have to do together as a community to prevent spread. Individuals protect themselves by getting vaccinated, and those are not the same thing. When you get vaccinated, you protect yourself. When we do things together, we protect the community.
So we want to thank Dr. Fine for being with us this evening. Just a reminder, get a booster, rapid tests for Thanksgiving, 2 tests to eliminate or to have a better efficacy rate or a better, fewer false positives. We'll do that. Also, as a reminder, our new COVID policies will go in place starting Friday, December 3rd, Saturday, December 4th. But there's a Hanukkah program is coming up quickly. On Tuesday, November 30th, we're having a Hanukkah dinner for people who are fully vaccinated on Tuesday night with catering, with accounting for taste. And then on Saturday night, we are having a Hanukkah party open to the entire community. All eating will take place outdoors, and everybody will be fully masked when they are indoors. We have a klezmer band that will have a Hanukkah dance party. And hopefully each of you will begin to experience coming back to shul when you feel the time is right. And you'll know that we're putting in many safeguards and many protocols to help keep everyone safe. With that, I'm going to turn off this spotlight and this one as well. And I will give you the ability to unmute yourself and wish each other a Laila Tov. Laila Tov, everyone.
Laila Tov.
Laila Tov.
Laila Tov, and thank you.
Thank you.
Laila Tov. Thank you.
Thank you, Laila Tov.
Thank you, Michael.
Good night, everyone. Thanks.
Michaels, both Michaels.
Good to
Very
see you.
interesting, Michael. Say hello to Carol.
Will do. Good to see you.
Thanks, Dr. Fine.
Happy Thanksgiving.
Good night, everyone.
Enjoy your families.